Very good afternoon and good evening to all our viewers. I am Dr. Sandeep Agarwala. I am cardiac surgeon from Zydus Hospitals in Ahmedabad. Today I am going to give you a lot of information regarding heart and heart-related conditions. Particularly, would like to give you information so that you can better prepare yourselves for cardiac surgery, especially if you have been advised one. So before we go into the details of what to expect when you come to an hospital for cardiac surgery, I would like to brief you and explain you about the basics of what a heart pump is, what are the various parts of the pump, and what are the potential problems which can happen in the heart which would probably cause someone to undergo a cardiac surgery or a cardiac procedure. As we all know, with our modern lifestyles, the incidence of cardiac illnesses and ailments is increasing day by day. What we used to see predominantly in the Western population is now seen in Indian population, in African population, in rural population as well. It is mainly due to our dietary habits and sedentary lifestyles, which has caused a spurt in the illnesses related to the heart. So before I get into the details, I would like to just show you a model of a heart, how the heart is, what are the various parts of the heart. Unlike what we draw in diagrams and see in pictures, heart is not what it looks like. It looks more like a fist-shaped structure which is inside the chest, and it is predominantly on the left side of the chest. So it has got various parts. Primarily, it is composed of pumps. There are two major pumps, one on the left side and one on the right side. And there are two small chambers on the top of these left and the right heart pumps, which allow the blood to travel from the top to the bottom. So the right side of the main pump is connected to the artery which supplies blood to the lungs. This carries all the impure deoxygenated blood to the lungs, and the lungs purifies the blood and then pumps it back into the left side of the heart. And from the top chamber on the left side, which is called as the left atrium, the blood comes down into the left ventricle, which is the main pumping chamber of the heart. And from there it is pumped, the oxygenated blood, the fresh blood is pumped to all across the organs to the major artery, which is called as the aorta. So in the beginning of this itself, there are three small arteries which actually supply blood to the heart's pump as well. If you can see carefully, the arteries are marked in the red. So one artery which comes in front of the heart is called as the left anterior descending artery. It's again one of the major arteries which supplies fresh blood to the pump on the left side of the heart. There is another artery which supplies the right side of the heart. If you can see it in the groove there, that's called as the right coronary artery. And there is an artery which goes behind the heart, which you may not be able to appreciate very well on the model, but this is called as the circumflex artery. So there are essentially three blood vessels which carry fresh blood and supply the heart's muscle itself, and which allows it to function without any problems. Apart from this, there are also valves in the heart which allow the blood to flow in one direction, from the top chamber to the lower chamber, and from the lower chambers into the arteries supplying the lung and the rest of the body. So if I were to show you, if I would separate this front wall of the heart, you might be able to appreciate that there are valves inside. One is on the left side connecting the upper and the lower chambers. This is called as a mitral valve. Similarly, on the right side is called as a tricuspid valve, which connects the upper chamber and the lower chamber of the heart. And if you are able to see carefully, these three white dots, one is at the base of the artery which supplies the lung. This is a pulmonary valve, and then there is another one which is right behind, which is called as the aortic valve. So these are they have three leaflets and they are called as tricuspid valves. So essentially, so what we have in a heart is not just about one thing. There are a lot of things which can go wrong. There can be problems related to the heart's pumping itself. The heart can get enlarged over a period of time, and the heart pump may not be pumping effectively, and that may cause symptoms related to heart failure. This may be related to problems in the valves. They may become very leaky over a period of time, or there may be a lot of calcium which might get deposited in the valves, which may cause the valves to become too narrow, and therefore they increase the stress on the pumping chambers of the heart. Apart from this, there can also be blockages which can develop in the arteries or the blood vessels which supply fresh blood to the heart itself. So these are the most common things which we routinely see in adult patients. Apart from this, I should also mention there can be problems with the electrical system of the heart. And if there is a problem with the heart's rhythm, then a person may need further investigations to see if he may benefit from a permanent pacemaker. So often we wonder, why me, and why should I get this blockages in the heart, or why should the heart valves not function properly in me? So when we come to the risk factors, they can be modifiable risk factors and certain risk factors which we cannot modify, which we are born with. So the non-modifiable risk factors are our genetics itself, our family history. If we have a very strong family history of a heart condition, whether it's related to the valves or if it is related to the blockages in the arteries supplying the heart's pump, then we automatically stand at a higher risk of developing these conditions. Also, in certain cases where they have connective tissue disorders like Marfan syndrome, where the tissue quality in the body is not very good genetically, they can develop problems with the valves. They can also develop problems with the arteries of the heart. So these are factors which we cannot modify, which we are born with, and we have to live with. But there are also a lot of modifiable risk factors which we can definitely modify if we identify them in time. The commonest is if you have any habits like smoking or tobacco chewing, these cause a lot of damage to the heart. And as they cause damage to the blood vessels also, they can be detrimental to the blood vessels elsewhere in the body as well. So if you have been smoking too heavily, or if you have been taking tobacco, then it is utmost important that you stop these so that they don't cause any damage in the heart or the lungs. Normally it is said that if you abstain from these two for almost 10 years, then it brings down the risk. So it takes a long time for the things to come back to normal. Apart from this, anybody who is above 40 years of age should also undergo medical checkups regularly. If not regular, then at least once a year, so that any blood pressure, high blood pressures, and diabetes can be diagnosed in time. Because these are silent killers, as we label them as. They cause symptoms very late in life, once already the damage process has started, and then it would be irreversible. So apart from this, if you have obesity, if your dietary habits are not good, then you need to take care of them as well. And if you have any family history of high cholesterol levels in the blood, then regular checkups, or at least once a year checkups about your cholesterol levels, will give you information. And if it is high, then if treated well in time, may cause less damage over a period of time. So as we have talked about, there are modifiable factors and non-modifiable factors. I'm sure if a lot of us would understand this and take care of the modifiable factors, the risk of developing a heart condition in the future would definitely come down. And people who have genetic history, who have family history, need to be much more careful, especially when they are younger as well. So the commonest condition which we see in adults, which comes for any type of intervention or surgery, is the coronary artery disease. When we say it's coronary artery disease, that means the three arteries which I have just mentioned, they have developed some blockages and which are causing the blood flow to not to be optimal, especially if it is developed slowly. Then somebody who has been walking regularly, he would start noticing that while walking or while exercising, there would be symptoms like heaviness of the chest, or sometimes there may be pain in the shoulders or even toothache, which is related to exertion. So if you are getting any exertional symptoms, then you need to be careful. You need to consult your family doctor and see whether they could be related to heart ailments. Apart from this, coronary artery disease, which we commonly see, is valvular heart disease. Usually in developing countries where socioeconomic strata people are sometimes are not very in clean conditions, they may develop a rheumatic heart disease. And rheumatic heart disease is a condition which affects the valves of the heart, and they can cause leaky valves or they can cause the valves to narrow down. Over a period of time, some elderly people can also develop deposition of calcium in the valves, and that is usually called as degenerative calcium related narrowing of the valves. Sometimes you might be born with two leaflets in the aortic valve instead of three leaflets, and because of this, the valve is more prone to wear and tear, and it can degenerate faster in life. Coming to coronary artery disease, I would like to show you what, when I say coronary artery disease, what does it mean? So if I take a cross section of one of the blood vessels, it's just like a pipe, and if we have cut it open, we can see that over a period of time there is buildup of cholesterol which causes narrowing, and if you can make out, the blood flow would decrease due to this blockage and narrowing. So in patients who have developed significant narrowing, they may develop significant symptoms, and in that scenario, they may need further investigations to find out whether one artery, two arteries, or all three arteries have significant blockages. There is often a confusion between angioplasty and cardiac surgery, bypass surgery, whether all patients with all kind of blockages are suitable for angioplasties or whether everybody needs to go for surgery. Let me make it quite clear that these two are not competitive treatment therapies. There are specific indications for angioplasty and there are specific indications for cardiac surgery or bypass surgery. And if we stick to these, then the long-term results tend to be good with either of the modalities. There is a basic difference between a coronary angioplasty and a bypass surgery. In coronary angioplasty, we normally do not open the chest, and it is done like a procedure in the cath lab, which has been done under local anesthesia. What they essentially do is pass a wire across this blockage and then put in a balloon. On the balloon, there is a spring-like thing which is called as the stent. So essentially, they inflate the balloon to open the blockages, and then they place the stent to keep that blockages open. So that is what they do in an angioplasty. Whereas in surgery, we do not do anything to the blockages. What we do is we bypass the blockages. Suppose there is a blockage here in the artery there. So we would take an spare artery or a vein from the leg or from the hand or from behind the breastbone, and we would connect it to the main aorta there, and then the other end is connected to beyond the blockage which is there. So instead of touching the blockages, we bypass the entire blockage and thereby establish the regular normal blood flow. So after going through the basic difference between angioplasty and surgery, I would also want to talk to you about the various valvular diseases which can be there. But let me tell you about the options available if somebody has been diagnosed with a leaky valve or a valve which has become quite small. So if it is something which is significantly narrow or significantly leaky, then a person would definitely require a cardiac surgery. And the options would be to repair the valve if it is possible, and if it is not repairable, then to replace it with an artificial valve. The kind of valves, artificial valves, which are available are either metallic valves or they are tissue valves. And again, the indications for each of them are different. By and large, the general rule which we follow is for younger patients, we tend to use metallic valves. I would like to show you a metallic valve typically, which is made up of metal, and it has got two leaflets inside it. So they open and close with the direction of the blood flow. So if you can make out, there are two orifices here, and the leaflets would move open and close depending on the blood flow. So that's a typical metallic valve which is there. And if a metallic valve has been inserted after open heart surgery, then a person would need to take blood thinners for the life. Similarly, if a person is elderly, is beyond 65 years of age, then normally we would not go in for a metallic valve because that would entail taking blood thinners for life. In these cases, we generally advocate a tissue valve, and that's how a tissue valve looks like. If you carefully look at, instead of having metallic leaflets in here, it has got uh, the tissues which are resembling normal leaflets. So if you see, these are the normal leaflets which are there inside. And with this kind of valve, you do not need to take blood thinning medications which require monitoring for life. Although there is a disadvantage associated with tissue valves, and they tend to last only for 10 to 15 years. So that is the reason why we would not like to advise inserting a tissue valve in younger patient who is less than 65 years of age. Sometimes, particularly in patients, in younger ladies who are in the childbearing age group, if they have not completed their family, they would probably be better candidates with the tissue valve. Although by doing so, we are more or less committing for a second surgery 10-15 years down the line. In some cases, we might be able to repair your native valve. If we are able to do that, nothing like it, because that's the best thing. And even if we repair it, we do reinforce that repair with a artificial ring so that the repair doesn't fail over a period of time. So these are the three things which can be used for patients with valvular conditions. Now, coming back to the basic things, what do you need to prepare if you have been advised for a cardiac surgery? I understand as a cardiac surgeon that whenever cardiac surgery to a patient has been advised, it is a very stressful time for not only the patient but also the family. It is indeed a major surgery, and definitely a lot of apprehensions and anxieties are associated with it. But at the same time, let me assure you that today cardiac surgery has become very safe procedure. Overall, in any standard surgery, the risk of surgery are only around 1 to 2% if there is no damage to the heart's pump. Obviously, the risk would vary from individual to individual depending on the condition of the heart, depending on the overall medical conditions which patient has, and also depending on the extent of procedure which needs to be done. But at the same time, this is no longer a surgery where a person needs to be scared to death due to this. I often advise my patients that practically the risk of getting a surgery done is very less compared to the risk of not getting it done. So if you have been advised surgery by a cardiac surgeon, then please do not hesitate. Please do go ahead. I understand the risks and anxieties would be there with it, but I'm sure that eventually all would turn out well for the person. So commonly the family and the patients would want to know that they have been advised either a cardiac surgery in form of valve replacement or repair or a coronary artery bypass grafting, and what should they do, how should they prepare to come to the hospital, with what time length they should be prepared to stay in hospital. So first and foremost, you need to come to the hospital with all your files, all your blood reports. If there have been angiographies done, echocardiographies done, then you would have been given angiography CDs and echocardiography CDs, which you need to get along with yourselves when you come in. Along with that, you also need to get all your medications with us, with you, so that we can have a look. And if anything needs to be modified, that can be modified prior to surgery. When I speak of medications, particularly you need to be careful about blood thinning medications. If you have been taking tablets called warfarin or acetone, they may need to be stopped prior to surgery. If your doctor has advised you to stop them before admission, then please do remember to stop them well in time. However, if your doctor has not advised to stop them, do not stop them, because if they're being used, they have been given for some particular specific indication, then the warfarin or the acetone tablets may need to be replaced by injectable blood thinners called heparin. Most of the times in elective planned cardiac surgeries, we would also want to stop blood thinning tablets called ecosprin and clopidogrel. So you need to confirm that with your doctor, how early you need to stop them before the surgery. Also, you need to make adequate preparations amongst family and friends to help donate blood, so that blood is often a requirement in these surgeries. Sometimes they may not be used, but we do need to be fully prepared before going for this kind of cardiac surgery. Sometimes a doctor may advise you to start lung and breathing exercises, and often you may get something like triflow meter or a spirometer, where you can take deep breaths, inhale and exhale, and get familiar with how to do these exercises, because if you're familiar with these and you're able to practice and do them well before the surgery, they come to a lot of help after the surgery. The day of admission, when you get admitted, usually there is no need to come starving from the home. You can come having your routine morning breakfast, and once you are admitted in the hospital, then your doctor would take your clinical history, reconfirm your investigations, diagnosis, and the plan of procedure would be clearly spelled out to you. Any further investigations related to surgery would be carried out the same day. And then you would also meet the other members of the team, your anesthetists, who would reassure you with everything. And they would have a very clear plan laid out for you for the next day. If everything is well, then surgery would definitely go ahead next day. And then they would normally do some preparations before taking you inside the theater. Normally, the anesthetist would put in few monitoring lines which allow us to monitor your blood pressures very closely. We would also be monitoring your heartbeat and heart rhythm, and sometimes we need to monitor the pressures in your lung arteries. So while you are asleep inside the theater and while the operation is being carried out, a lot of monitoring is done so that any controllable risk is controlled well in time. Usually, any major cardiac surgery takes around 5 to 6 hours from going in to coming out of the theater. And by and large, most of the centers, most of the places would allow the patient to come into the ICU after the cardiac surgery while he's still on ventilator. He's deeply sedated and still not out of anesthetic effect. And after 4 to 5 hours of observation, once you have started waking up, and if you're comfortable in your breathing, and if your heart pumping has been good, if all other parameters which we are monitoring are well within the normal limits, then we would go ahead and start waking you up. And if you're comfortable, then we may be able to take out the ventilator the same day or the next day. And then subsequently, you would be able to talk, you would be aware of your surroundings, you would be able to meet your relatives, talk to them, you would be able to talk to your doctors and tell them about the degree of comfort or uncomfort you have. And I'm sure depending on your pain threshold, we might be able to add on more painkillers to keep you comfortable. I believe pain is one of the most common concern of any patient who is having cardiac surgery. But at the same time, it is very reassuring to know that usually pain is not a major issue after cardiac surgery. We are already covering most of the patients with very strong painkillers, and they are able to manage without any problems. So once the ventilator is out in the ICU, you would still be there in the ICU for maybe a couple of days. Once all the tubings are out, once all the infusions are out, you've started eating a little bit and you've been able to exercise. If your oxygen levels are remaining good without any oxygen, then the next step is to start getting you out of the bed, to start allowing you to walk around a little bit. If you are absolutely comfortable walking in the ICU, then you've already passed the major part of the surgical timeline, and then you would be shifted into the room. And then from there on, it would be 3 or 4 days, depending on how well you are able to walk around, eat, and sleep, and how comfortable you are in terms of pain. But believe me, the more active you are after cardiac surgery, the faster is the recovery. Also, after third or fourth day, usually your scars and the dressings would be checked whether your stitches are healing well, and if they are healing well, then nothing further needs to be done. There may be a few post-operative investigations which may be done fourth or fifth day, depending on your individual needs. If you are doing well, then most of the patients, almost I would say 95%, are discharged within a week after the surgery. And beyond that, once you're home, you're again supposed to maintain your active lifestyle. You're supposed to walk around, do your breathing exercises, eat well, and sleep well. After a week, normally, we would again check the dressings in the outpatients department. And if they are absolutely fine, stitches would be removed, and in a day or two, you would be ready to start taking bath. So, as I said, the more active you are, the better and the faster would be the recovery. As regarding, a lot of people have queries about the diet which they need to take immediately after cardiac surgery. As a surgeon, I usually advise to take them everything as per the need. If they are diabetic, then they obviously need to curtail the sweet things which they have to take. But apart from that, once they recover only, then dietary modifications need to be done. In the initial 10-15 days, while the patient is recovering, I normally do not restrict any dietary things significantly. But you have to be very sensible about not going overboard and not eating things which are going to be unhealthy to your heart. Also, one important piece of advice: after an open heart surgery which has been done, usually for 6 to 8 weeks, we do not advise anyone to lift any heavy weights or to do any driving, because 6 to 8 weeks is the time the bone takes to heal. After 6 to 8 weeks, one can get back to his normal spectrum of activity. Often there are queries regarding when can I get back to work. If somebody is not doing a lot of physical work and his work involves an office job, then he may join back his office job in a span of 2 to 3 weeks. It all depends on how confident the person is, how well the person is mobilizing, and how good his pain threshold is. If he is absolutely comfortable, there is no restriction per se not to do any job, especially if the person is doing an office job. If the person is doing a physical job, has got a lot of physical things involved in his job, if there's a lot of weightlifting involved in his job or driving involved in his job, then it is better to take rest for at least 2 to 3 months. So I believe with this information, I have given you some overview of what to expect while coming for a cardiac surgery. I would be more than happy to answer any questions which you would have in your mind. If there is any need, if you are unable to catch me today, then you can definitely contact us at Zydus Hospitals via email or Facebook or through our contact numbers. There are a few queries which have come up on this session. I would like to address them now. So one query which has come up is, can there be other organ malfunction while surgery? Yes, heart is connected to all the major organs of the body like brain, liver, lung, kidneys. There is definitely a small risk of that happening. However, that risk is usually in the range of 1 to 2%. If any of the organs, then usually this is temporary and recovers to its normal after a period of time. Individual cases may vary depending on the medical conditions and comorbidities. So there is another question which says, how long can the hospital stay be? Average hospital stay is between 8 to 10 days. As I have already mentioned, if the surgery post-operative recovery is uneventful, then it is usually 8 days. Another question which I have got is, how about gym exercises after the surgery? Can I continue? As I have already mentioned, it takes 6 to 8 weeks for the bone to heal in the front. So it is better not to do any heavy gymming exercises, because that would cause pull and push on the bone, and that has potential to disrupt your surgical wound. So at least one should wait for 2 months before starting any heavy gym or bench presses or weightlifting in the gym. But yes, routine walking around can be done as early as third to fourth day after the surgery. The more walking around and the more activity you do, the better you feel and the faster you get back to your work. Another question, will I be required to stay inside ICU after surgery, even if the surgery is without any complications? Yes, all cardiac surgery patients have to be moved to ICU after the surgery for close observation. Usually, the period of stay in the ICU varies from 2 to 3 days. It will depend a lot on how well your condition before the surgery was and how well your body tolerates the surgery. But on an average, almost 90-95% of the patients move out of cardiac surgery ICUs by third day. Are there any food-related precautions to be taken after surgery, like fats and cholesterol? Yes, dietary modifications and lifestyle modifications are a part and parcel of the surgical treatment. Surgery on its own does not prevent from blockages coming back again in the future. So apart from the initial post-operative phase for maybe 15-20 days, 1 month or 2 months till the time you have recovered well to your normal, after that definitely dietary precautions have to be taken. If your cholesterol levels are high, then they need to be treated properly by medications. Exercises need to be done. If somebody is overweight or obese, then it would definitely help to lose some weight after the surgery. So if somebody is not sleeping properly, then sleep patterns need to be reestablished. So lifestyle modifications, dietary modifications have to be followed throughout the life. This is in addition to the medicines which would be prescribed after the cardiac surgery. So that's all for today. It has been a pleasure talking to you and sharing some information which might be of help to patients who are planning to undergo cardiac surgery or even those who have undergone cardiac surgery. Thank you so much. And as I have mentioned, we will be more than happy to have any queries from you regarding this subject. And you could contact us via our email or Facebook site or Sidus Hospital switchboard contact numbers. Thank you so much.